Hi, welcome to Postcall Beyond the White Coat. Now, this podcast is where we'll explore doctors who are impacting healthcare differently. I'm Dr. Selina, your host and co founder of Disruptive Doctors. Now, at Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. Now, join the movement and sign up to our website to connect with a community of forward thinking doctors who are doing healthcare differently. Now, in today's episode, I'm excited to introduce currently MH Nexus Business Strategy Development. Dr. Hui Mei was a former surgical medical officer who pivoted to business development and digital health transformation. Now, what drives an ambitious surgical medical officer to transition into business strategy and digital health? Tune in to listen to Dr. Hui Mei's inspiring story of overcoming career stagnancy and exploring new opportunities in digital health. Now, this is an episode you don't want to miss. So, if you're ready to be inspired by your peers who are leading the change in impacting healthcare differently, be sure to subscribe to our channel. This is Postcall Beyond the White Coat. Now, thanks for joining us today, Dr. Hui Mei.
Hi, Selina. Thanks for this generous introduction.
Okay, maybe Dr. Hui Mei, why don't you share about what drew you to initially to this career in medicine?
Can. I think we all as doctors, we get that question quite a bit. So mine's a little bit of a cliche. My dad's a GP, right? So I've been exposed to his career as a doctor all this while. But I wouldn't say there's anything poignant that drew me to medicine per se, but rather it was just a gradual transition towards the familiarity of my father's career as a doctor. And that draws me to his work and the things that he do. Because I think the last few years before when I joined university and actually decided to pursue medicine, I had a change of heart, really. Decided I didn't want to do medicine. But it was this thing that he said, I don't think you could do it, that spurs me to, you know what, I'm gonna do it. So it's not quite so of really my passion for like being a doctor serving community at that point, because although I've seen my doctor practicing in the GP setting, it wasn't really a full representation of lifestyle of a doctor, what the doctor really does. I think we get that you get a taste of doctor's life career later on when I actually embarked and came out to join the workforce.
Actually, that's true. Because in medical school you're so sheltered, right?
Yeah.
No one really tells you what's out there. It's all theory, theory, theory. And even if there was any practical, it's just a case study, right? Not the life of a doctor.
Correct. You probably give you a little clinic setting. Even in the ward, you don't get the full hands-on experience. You see the doctors bustling around, the patients moving around. But from my point of view, as you mentioned, it was a lot of studying and the things and the experience that we learn in med school when we go out and join the workforce as an actual intern or a houseman. It's a totally different experience. I feel like I was very unprepared. Although we've gone through a lot of case studies, bedsides, and so on and so forth, it was definitely the whole new experience when I came out as a hub.
Okay, can you explain a bit about being unprepared? What
Yeah.
did you mean?
So being prepared, I guess we'll talk about unprepared is a lot more on the application of theory, number one, and also dealing with the patient. I guess I come from Monash. Monash, in that sense, they gave us a lot more exposure in soft skills. So that was, I felt, something very helpful. But the theory of soft skill and in the simulated case studies that we have in Monash is very different in the actual experiences in Malaysian hospitals, because then you have your constraint of your patient emotional baggage, and then the constraint of time, then the urgency of the situation. So really, when I joined, it was, for me, I struggled, I guess, in my first few months, having to cope with the challenging environment that I was in. I guess because the patient burden in your clinical setting is always on the higher, and the expectation is also very different, because it's less in your medical school is a lot more controlled environment versus you get thrown in that houseman environment. So for that point of view, I felt that I was unprepared, I guess emotionally in that sense. Because when you talk about theory, we've gone through that and we pass out as a doctor. So we have all that in sight. But applying it in a very urgent situation or in like a situation where it's like emergency, you tend to freeze a little bit.
Okay, so you worked as a medical officer, right, in surgical department in the government for 8 years. So what was it like, and what was your aspiration back then?
My aspiration back then, um, yeah, my time spent in the government setting was very challenging. But I guess in that sense, it was also helped build my character and in terms of personal growth, right? But back then, as the officer, I think me and my cohorts as alike, we all can only see a set career path. Like as a doctor, moving forward is only like you either specialize, you join the administration, or maybe if you want to come out, you come out with private practice. So that was us back then, maybe a decade ago, from medical student to myself as a medical officer. We were indoctrinated in that particular career. So digital healthcare wasn't very big back then, nor was like a healthcare management at the time. So for me, my time spent in KKM was really building towards that. How do I join masters? How do I specialize? So it's a lot of studying and collecting case studies, poster reviews, so on. So that was a whole 6 years doing that, building up skills only in a very certain area, surgical. Because I've been I like surgery because it's a blend of both medical as well as skill set, the surgical skills. So I think that was my whole entire 6 years that built me up to where I was before I left. It's like experiences and all the ticking off all the checklists on how to join the master's examination.
Okay, so you were building up towards joining the master's program. So what was that pivot point? What made you decide to leave clinical practice? Was there a specific moment?
I guess the specific moment happened immediately after my master's interview, the second master's interview. So I applied twice. I didn't get it. But even before the result came out, I knew immediately it's like this would not be the lifestyle or the career pathway that I would want to go further into my studies, right? Because as I spent a good 6 to 8 years in the surgical field, so I've seen my colleagues, my peers, my seniors transition from to a surgeon. In the beginning, for me, I thought I did not have a choice. But as we see them on like a year-to-year basis, that although you reach the surgical level, a number of them will come back. We talk to them, right? So they are unfulfilled, and they would think it does not. You would think that being a surgeon is a milestone that you achieve. You should be happy about it. But what I realized that they are not. They're still unfulfilled. They're still unhappy. And for them, it wasn't really what they want, because I have a lot of them from after you get a surgeon, they will move towards actually being a data analyst or even working in health tech. So that sort of clicked into my mind. It's like, oh, you could just drop everything because you spent so much, like almost a decade of life studying and being a surgeon, and then coming out, what they realize is they're trying to fit into the career norm rather than deciding on what they really want. So I think after that, I realized that the lifestyle they had as a surgeon is not something that I want. And therefore, I think during the second master's interview, I sat down and I spoke to my husband, who is actually my biggest supporter. So we talk about a potential pathway that doctors could have. Because I think that was 3 to 4 years ago. Digitalization was picking up back then. So we can see actually there are doctors moving into health tech, doctors moving into hospital management per se. So I guess I wasn't, I was a little bit more reassured, although I was still unsure of the path. Yeah.
Okay, what was it that decision? I mean, because that's 5 years of medical study, all geared towards that one moment, right? Becoming that
Yeah.
specialist. And then there is that housemanship training, which is not easy. It's like so much of uh, trying to swim and not sink. And then there's that
Yeah.
few more years of being a medical officer, just honing that skill, and then all towards that one path, which is to become a surgeon. And then now you're at this crossroad. Was that difficult? I mean, how easy or how difficult was it to make that decision to jump?
Uh, it was difficult. Honestly, it was difficult. So I've made the decision to not pursue masters. That was probably, I think I left in 2021. So in 2019, I made that decision. But as to, okay, so if I announce to my then bosses, I'm going to quit. So, okay. So after quitting, so where are you going to go? So his first thought was going to join GP in a statistician, because I think back then, if you go to private, that's probably where you go. Either you go GP practice or you go a statistician. A statistician was booming back then, making a lot of money, right? So yeah, I guess so, maybe, yeah. So my boss back then, he is one of the mentor that I truly respect, and one of the reasons why I ended up where I am today is also I'm thankful for him. So because he's very future minded and he's a big believer in data and technology, constantly improving himself. So he said, okay, 2 years, leaving, quitting. So why don't you, instead of quitting now, spend the time with me, working with him. That means moving from my clinical role to a more administrative role to help him, actually assist him in National Surgical Service planning, because that's what he's doing. So take the time to think properly what I want to do, which I'm very thankful, because anyway, it was COVID, like I said, you can go anywhere, right? Hui Mei. It's like, okay, I'll stay. So the 2 years I spent with him, then it exposes me to him as surgeon, consultant, and he's still doing administrative planning of healthcare services, just financing perspective, for what other things that doctors do from a leadership perspective.
Okay. Yeah. So like as I was saying, my boss was he's more like a mentor than a boss, right? So he helped me to figure out, he gave me the time to figure out what I want to do, because he wasn't very happy with my answer when I said I want to go to GP and the statistician. He's like, why don't you come over, help me out with, because he's my then national head of surgical service planning. So he said, come help me out, do help with the data that I have, collect, manage it, and take the time to think of what you want to do. Because anyway, I think later on in 2020, COVID hit. I couldn't have left anyway. So that was a fantastic opportunity for me to learn of what he does as a business administration. Because at the end of the day, from his role as a National Surgical Service head, I think he helps KKM to plan all the services, including financial and budgeting allocation. So it's more of a business management kind of role, which I find very interesting. So I think from then on, I really did a little bit more digging and on what other career path that the doctor could have. And I think that helps me narrow down the focus on where I want to be.
Okay, when he asked you to help him out with the data, I presume you had to do data collection, or you were analyzing data?
Both, I suppose. So it started off with data analyzing. So my colleague and I, when I joined, there was another colleague as well that assisting him. So data collection was very manual. It's like we have to contact like each of the hospitals. Can you send me the data? So it's in Excel format, and there's all the multiple formats. So it's like, what in the world am I doing right now, right? So it's like, there has to be a better way to utilize this Excel, because I think my Excel skill when I was a medical officer was as the basic as you can get. So along the way, we learned formulas, we learned all the automation within Excel, and that got me very interested. It's like, wow, I managed to do this as a medical doctor. So that was very fulfilling, because it made my job easier. And later on, when I able to show that ability to my mentor back then, so he said, you know what? Why don't you analyze this data and then you pass it back to me? So I get a lot more hands-on and involved in the planning. So rather than just him giving me a framework, we will just build a slide. It's really, Hui Mei, why don't you take this slide, do it, use the data, you tell me why I need to go in this particular proposal in this manner. Why is this way better than the other one, by like looking at the data. So it was a lot of mentorship and learning period from him that actually brought my interest, and also helped develop my sense of critical thinking in the business side rather than purely in the medical side. So I think he helped me leapfrog into the whole business corporate world as well. I have to thank him for that.
Wow. Okay. Do you want to do a shout out to him?
A shout out to, I guess, thank you, Dr. Suri Yusof. He is currently actually in MSU University right now working. So again, thank you so much for your mentorship and sharing all your knowledge with me.
Wow. Okay. Was there a mindset shift that was needed for this? Because you see, most doctors have this pride and value that I'm seeing patients, I'm doing all this, and that's my value. And now all of a sudden, back behind the desk and then doing all this manual labor of some sort. Did you have to have that mindset shift?
I do. So it's like when you're already so senior in your clinical field, right? As where I was. So I was really a lot I was their mentor. I was telling them how to do stuff and I was giving the plans. You were in charge of patient care, right? So it's a lot of authority and autonomy there. Whereas when I moved to corporate, I think the transition into the first year of corporate was the hardest because it was a humbling experience really. It's like I mean they're speaking English, but I don't think I understand what they say. This was a corporate lingo start being thrown around. It's like, oh, there's RI, EBITDA, yada yada. I was like, what is this? So it's really I felt like I'm a houseman all over again. And it was in I guess like you mentioned, doctor with they have a slight pride to them, to their work and a little ego. So I felt terribly stupid back then. But what I realized along the way is that no point feeling sad for myself and all. So it's a lot of self learning and a great deal of motivation to take that failure in. That things that you don't know because again, I mean, I don't have a business background. So a lot of working with my colleagues and truly believing that there's more to learn out there than being a doctor. Being a doctor itself is not great in all settings. We were good in what we did in the hospital setting. When we move out, I think you have to be very open minded and in that sense and very humble. I think humility is a very good trait to have to boost that continuous learning rather than taking it as a setback.
Okay, tell us, how did you transition out, like from surgical,
Yeah.
sheltered within KKM, no idea how to write a resume, don't know how to, never done an interview in your life, and then now suddenly, you have to go out. The corporate world is different. Like, how was that process? How did you get in?
I was lucky. I was given the opportunity to join my first corporate role by a friend, actually. It's more like a referral process. So he knew that I was looking for an exit. And I think by then I've noted that the digital healthcare, digital transformation was something I wanted to do. So, but the role that I was given was business strategy and development. It was more businessly inclined, right, rather than tech inclined. But for me, I was like, it's an exit, and I saw digital transformation. I just grabbed the opportunity and I left. So, again, in my entire 10 years in KKM, we've never done much interviews. We've never done any series, so on and so forth, right? So the interview back then, but thankfully, my managing director, the hiring manager, was actually a doctor as well. So it wasn't very hard in terms of the interview process. But they can tell that I was a very green little doctor trying to come out. So there was a little bit hesitancy on that side to bring me on board. So I had to go an extra step of interview because they needed convincing. So I guess at every stage really is I had to relearn the interview process. And I think by my third year, actually, I've attended numerous interviews. Then it's a lot of practice, I would say. And secondly, of course, you require a lot of research on how to format interview processes. So that structuring interview CVs and all is on a year-to-year basis. I'm still constantly improving myself. I think by now I'm a little bit more confident in introducing yourself because at the end of the day, most interview process they're quite structured similarly. Yeah. So that was additional skills that I learned.
Okay, so what was the challenges and the learning curve? Like, how is your current role, like what you've done since you left clinical? Like, how is it different from your clinical role? What's your, the day to day now?
Yeah. So I guess in the clinical role, we are our day to day are more structured. We have like morning you do rounds, then you have clinics, then you go to OT, and then you repeat the following day, right? If let's say anything happened, there's always a set guidelines on how to manage the patient. Versus I guess in corporate, it's very hard to put it in that sense. Like you do this, 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 this. because in the business world is a very dynamic and evolving world. So clients appointments, engagement, stakeholder engagement, it can happen like tomorrow I need you, tomorrow I need a proposal. So I need to pivot a little bit more agilely in that sense. But I guess as a medical doctor, we were trained to handle that particular changes better. Because for me, it was very stressful initially, but as I get a hang of it, it's something that I could do quite easily. For example, my boss would text me on a Sunday saying, you know what, we have an important presentation to this stakeholder on the Monday. Can you do it? I need to see the proposal by tonight. So honestly, I'll be like, oh my God, that's ridiculous. This is Sunday. But then what I realized is that I have all the resources at hand. Instead of doing from scratch, we will just take a step back and then we pull everything together. And I was able to do it also because thankfully to my surgical and medical training. I think it prepared us to plan ahead and take a step back to be able to maintain that cool and calmness when you face with all these challenges to say.
Okay, so can you explain what your current role now is, like as a business strategy and development lead? Understand is at MH Nexus.
Yeah.
Your primary responsibilities now.
Okay, so MH Nexus is a IT consulting company. So our core business would be in the health information exchange technology. So my role and in BD and strategy lead, I have two parts of my role. So the first part would be the business part of it. So that would involve me identifying a target segment, for example, for a product. What are conduct the due diligence, your market analysis, and later on conceptualize the solution that for the identified segment. Later on, planning the business model as well as the go-to-market strategy. So that's the business part of it. So it involves a lot of proposal planning, engagement with stakeholders, what are their needs, their gaps, right? And working with the technical team to formulate the solution. The second part of it on the product incubation role that I also undertake because of my experience as well as my clinical expertise. So right now, we have a group of IT team in my company. So I would sit with them to identify what kind of product and solution that we want to build so that we're able to sell it to the customers. So this one, compared to my business focus, this one is a little bit more technical. So in terms like, I want to develop a e-referral solution, for example, what are the nitty-gritties of it? How do I click? What do I click? What are the functions and features? Because I think the clinical process is important in developing the solution for the user experience, right? So the technical team that we have, they lack in that particular area. So that's where I come in and on top of advising, working very closely with them to develop the product.
Okay, earlier on you mentioned that you had to take a lot of initiative to learn stuff, to pick up stuff because you are coming out as a very, very green doctor, right? And I know you came for one of our AI workshop in
We
the
did.
past. Yeah, so can you tell us a bit more about that? Did someone, in as a government doctor, I guess you're always waiting for someone to send you for a course, for some kursus and all of that. And if nobody sends you, you just don't learn anything, right? You don't want to spend money out of your own pocket for your own learning. So can you tell us a bit about that and how was that course for you?
Okay. So I think for me, how I decide to improve and upskill myself is based on that particular role that I'm in. So in my previous role, I think there was a lot more. I needed more foundation in business skills and business administration skill. So I took things like how business generating business insights from data analytics. So short courses here and there. Because I think selection of courses really depends on the gaps that I identified in my entire role in that particular point of time. So when I moved to MH Nexus, which is an IT company, so I needed to upskill in the technical field, right? So I think AI has always been my passion and interest. I think moving forward, AI is where I want to be. So I think when I was proposing to my boss, my current boss, where on the AI this workshop that Disruptive Doctor is offering, I said I want to do this one rather than things in Coursera and everything. It sounds so much more amazing. But that's the thing about learning a technical skills. I would like the interactive and more physical and more hands-on session rather than a recorded session, which I feel because I've attended a few, and it is a little bit limitation on the information, knowledge transfer because you can't see, you can't imagine. So when I'm having issues, if I say everything happens verbally, it's tough for me to imagine because again, it's not it's a whole new section that I'm learning. So the AI workshop for me was very eye-opening. I loved it because I think that was my first time opening VS Code and downloading it. I remember Dr. Zuhairi, his session, but he was very reassuring, saying like you don't need to memorize the code, you just need to learn the concept of coding and pseudo coding, which I felt was very, very important. Because then I can I guess I can further identify the areas that I need to improve on, not necessarily full coding. I just need to know how to work, concept of it, so I'm able to engage better with my technical team.
Okay, so how do you integrate, your clinical expertise into your current role in like business development and strategy? Like, how does it benefit the projects?
Yeah. So I think the project, one of the things that I've learned in my 3 years currently is that conventionally, I think a lot of technology and solutions were developed independently of bringing in doctors into that whole development process. So we have some solutions that are not so user friendly, i.e. the doctor. So why is it done like that? It doesn't seem to be solving my problem, right? So I think IMH Nexus is also one company that brings in doctor into the technical team, making them an integral part of the technical team rather than just being a consultant or subject matter expert. Because I think what I can see the role differentiation would be as a consultant, as a subject matter expert, I will sit here, lend my knowledge, and I blah blah, a lot more verbal versus integrating me into the part of the product development, right? So I will sit with them from conceptualization all the way to implementation. It's end to end. So I will sit at every part of process of development. My input is there to help them improve and fine tune that solution so that we're able to cater to the doctors more efficiently in that sense because of my knowledge in the workflow process.
Actually,
Yeah.
I do, I do agree with you on that. Like, years ago when I was a medical officer in the ICU, one of the hospital that I was working at, in the ICU, you have this huge 24-hour chart, a daily chart. And the chart is actually very important. There are like 6, 7 parameters that are like, what are you looking and how do they correlate with each other? Like, you want to
Yeah.
know. And the purpose of that chart is really to find out what is that particular moment, right? If a patient collapses, what happened? Because it's not only what happened right now, but what happened 2 hours ago, 4 hours ago. What did we do
Right.
back then, right? Then you know what's going on now. So I remember being in this one hospital. They decided to chop that chart out to put it to digitalize it, to
Yeah.
put it in a computer. So you will see 24 fragments of the
I
chart.
think I know that system. Yeah, I've worked with it as well.
Yeah, it was so bad. I remember when once a patient collapsed, we did not know what was going on. Everyone had to stop work. Someone pick up a computer wherever, and then we tried to piece all the information together to see what's happening to that patient. Why is she collapsing right now? And I remember it took like 10 minutes just to piece stuff together. And 10 minutes in the ICU is eternity.
Absolutely, I can totally relate to that. So that's the thing that we don't want to happen. So I recognize that we have as a doctor in health tech, right? We have a growing role in that sense. We don't just want to be a participant. In the past, what I think some people would say, oh, Namana, you go private, right? You just be a consultant. You don't need to know the technical stuff. I disagree with that. For us to be an effective team member, I do have to learn the technical stuff. I need to know the terminologies. I need to know how the process work, how product development process work. Because without that knowledge, unable to actually advise better in the product development, because my impact will be more minimal. Because again, example, right? When I tell my technical team, okay, I need a referral solution. So this is a process like that. So they will come out on based on what they understand by it, but the workflow will be entirely different. Again, they're technical people who have never been in that process. So it's like I draw an image of a chicken from what I think a chicken looks like versus as a doctor, right? This is the chicken I'm envisioning. So that was the one of the challenges I faced in my early career, right? So what I realized is you do need to speak their language, their terminology. So when I cannot make them see from my point of view, is really hence all the upskilling in the sense of attending AI workshop, computer introduction to computer science, is to be part of their team. But when in Rome, do the Romans do.
So what do you think the impact of a doctors in this healthcare, in digital health moving forward? What do you think a role of a doctor would be?
I think moving forward, we will be, of course, doctor will be the main drivers. It's easy to convince other doctors to adopt technology. So technology adoption is a little bit challenging in our setting, I suppose, because again, certain technology are not yet mature. And for as a doctor, I think from our point of view, our patient safety is always of utmost importance. So you constantly think it's like your ICU situation, right? If technology will cost me the life of my patient, that is not so great for me, especially if I'm in a private healthcare setting. So convince the doctor to use it is really by evidence, by actual proven that it works. So for a doctor to be in that particular conversation from a health tech company, I think a lot of them value my role as a doctor to help convince our potential clients and potential partners, because we are able to relate and understand their pains, their worries and concerns, right? So one of them, that's one potential role. Secondly, in terms of health tech, is as I mentioned earlier, as part of the product development team, to be the person, how can I say this, that I want not only to consult and advise, I really want to be the part of the future, involved in designing and developing the solution that future doctors and patients would use.
Okay, can you share with us like some of the projects that you're working on now, and how what sort of impact on healthcare providers and patients?
So as I did mention, MH Nexus is our core is in health information exchange platform. So the health information is like it's technically a data exchange platform for the healthcare setting. So that is a technology that we specialize in, right? So from the technology, my role will be how do I develop products from the technology? So data exchange platform, what setting for what purpose. So that is where I come in. So along the things that we are doing are like appointment and scheduling system, as well as your computerized physician order entry. Because imagine we have gone through digitalization. So most hospitals in the private and some hospitals in the public have some form of digital record, your EMRs, right? But the thing is, they are of different standards. So these EMRs are standalone. So they do not exchange the patient details when needed among themselves. So my patient will still carry the private, all the, oh gosh, that's my cat. Probably cat that out.
Yeah.
So yeah, so in terms of record exchange for your clinical care, it's still a very manual process. So where we come in is like the health exchange platform will connect all these systems, various systems, for the betterment of your patient care coordination. So for example, in hospital A and hospital B, I'm using different system. So the product that we're developing is the backbone of it, the data exchange platform that allows my patient to, regardless of where I move for my healthcare service, I'm able to collect in a single page my historical records as well of all my comprehensive care plan. So Yeah, I think moving forward is very important, especially in these days when we talk a lot of digital transformation, talk about integrated care and a more unified healthcare system. That's where our technology is supposed to help.
Okay, so what is your advice for young doctors, or not just young doctors, any doctors who are considering a non-clinical path? Like, what would you advise them based on your journey?
So what I would advise would be doing the uncomfortable thing. I think because in terms of career progression and personal growth, it's always choosing the more difficult and doing the uncomfortable part of it. Because a lot of us, we hesitate in taking that leap out of clinical or out of KKM even, is because we are unsure, we're very anxious of what lies ahead. So what I realized in my 3 years is that uh, a doctor need not just remain in your clinical role. There is a huge wide world out there. It's really like an ocean of, you can go to tech, you can go to a business, because healthcare is becoming more and more of a business. How do you manage your resources, your manpower to give back and to develop your healthcare service that's needed? So we should change the perception of what can a doctor do, right? Last time it was just set, like, what we thought we could do is only towards a specialization. Now it's beyond that, and I think that's, you would know this better than me. Yeah.
Okay, so what's your what are you most proud of in your career?
I think I'm proud. What I'm most proud of really is how evolved my working style has been. So I think in the past we work in the same cohort of like-minded doctors. They're all medical degree graduates. So working with them, communicating them was very much easier. So for me, I guess I can be quite nasty as a senior doctor back then. But moving into the current position, what I'm most proud of is how I have been very much tolerant and patient, and I think I've developed a knack and so an interest in teaching and mentoring all the young interns that I work with. They come from diverse backgrounds. So working with a cohort, your peers of different background and different mentality and different strengths, right? That requires a lot of soft skills and patience. So for me, I have grown into a role that I think I'll be proud of as a mentor. Because back in those days, medical officer, we wouldn't have time to mentor all our junior husband. I'm so sorry to them, because we were very burdened with all the workload and the time constraint of it. So I was not a very great teacher back then.
I think we all learn through mistakes from the past.
Yeah,
So
that's true.
how do you stay motivated and inspired, to continue making an impact in healthcare?
Well, there's two reasons. One, of course, my husband, my greatest supporter. I think it's very important for everyone to have a great support network, because they are the one that will bring you and carry on, reassure you throughout your journey of self growth and all, right? So he has always helped me and constantly tell me it's okay if you fail. Failure is the greatest teacher. So I totally agree with that. And of course, the second reason constantly motivates me to go further is the people that I talk to. So I think in the corporate world, we meet people from other industry. They may not be doctors, but there are a lot of women leaders, as well as inspiring people who are non-healthcare based, that has worked in digital health tech. So these are people, as you talk to them, then you learn from their perspective, you learn from how they do it in their position. I think that inspires me to say, you know what, this is what I want to do. They keep the constant networking that we get. They are also, in a sense, a teacher to me.
Okay, thanks, Dr. Hui Mei. I think I really understand that. Like, that's building this community in disruptive doctors is really to help doctors connect, collaborate, share ideas, like how Dr. Hui Mei has. Thank you, Dr. Hui Mei, for sharing your story today and being so candid about experiences. So that wraps up another
Thank you for having me.
Yeah, so that wraps up another episode of Postcall Beyond the White Coat. I hope you enjoyed our conversation with Dr. Hui Mei and found it as inspiring as I did. Remember, there's always more to being a doctor than within the hospital walls. So if you're a doctor and you're ready to impact healthcare differently, be sure to join us at Disruptive Doctors. Follow our social media, subscribe to our podcast, and don't forget to leave a review. Every year, we have an annual conference that's called the Healthcare Revolution Conference, where doctors are impacting healthcare differently. And Dr. Hui Mei will be on our panel this coming August. So be sure to join us. So your feedback helps us to bring more stories of doctors who are changing the game. So stay tuned to our next episode where we'll continue to explore how doctors like you are making a difference beyond the white coat. Until then, I'm Dr. Selina. Take care and keep disrupting the norm.
Thank you.